afternoon and welcome back here in our ESCMID Global TV studio. I am Judith Cohen. I am your host for all your global TV broadcasts this Congress, and I'm very happy that for our final interview for today, don't worry, we'll be back tomorrow. I have two people here joining me live in our studio here in Hall 8.1 of the Fira Gran Via in Barcelona. We will be talking a little bit about the educational session that they are both participating in tomorrow on current rapid diagnostic testing. So right next to me I have Professor Surbhi Malhotra-Kumar. Warm welcome to you. You are a professor of medical microbiology working at the Expertise Center, Vaccines and Infectious Disease Institute at the University of Antwerp in Belgium. And next to you we have Professor Jaroslav Hrabak, also working medical microbiology at the Charles University in Pilsen in the Czech Republic. So warm welcome to both of you. You will be joining you will be adjoining speakers tomorrow morning at the educational session, which starts at 8:30 in Hall F for our viewers who are planning to attend. And the session is organized, I understood, by ESCAR, one of ESCMID's study groups, and this one is a study group on antimicrobial resistance surveillance. And that is the general overlapping topic, of course, of all the talks that will be part of the educational session that you are speaking in. Rapid detection of antibiotic resistance, state of the art. So I think it would be really interesting for our viewers to just get a little bit unveiled of what you will be speaking about tomorrow. You don't have to spoil the whole talk, of course, but I think it's a really important topic, the topic of antimicrobial resistance in general, and of course the ways to get better surveillance. So Surbhi, would you like to give us a little insight in your talk for tomorrow?
Sure, Judith. So the talk tomorrow that I will be doing is on the molecular detection of AMR, antimicrobial resistance. Now, during the last decade, we've had quite a few tests coming up, mainly amplification-based, which means that we try to amplify certain genes related to antimicrobial resistance, but also to the pathogens in these kind of syndromic panels, like you're trying to detect the causative pathogen of bloodstream infections, and therefore you target both the pathogen and the antibiotic gene, and this is really very supportive of antimicrobial stewardship in hospitals. Also for patient care, it's extremely important, given the fact that we have a very high prevalence of antimicrobial resistance worldwide. It's very important to be able to detect that at the same time as the pathogen. And that is what my talk is going to be about, because there has been an introduction of these syndromic panels, which also encompass important antibiotic resistance genes. But what exactly is the outcome till now? Is it something that, is it a direction that we should continue to take? And I believe yes. So I would put forward the pros of actually going for rapid molecular testing and having labs trained to do that. And essentially hoping that patient care, or at least the switch from empirical antibiotics, which is antibiotics that are given without having a diagnostic test, can be switched much more quickly to the right therapy.
So how rapid is rapid? And is it rapid enough? Or do you think we need to further develop?
Well, I think we can always do better. But there are new tests available that can, in fact, detect within up to 6 hours directly, for instance, in sepsis from whole blood. Of course, the point is to keep on doing better, to have better sensitivity, specificity, and ease of use. I think that's very important, because several of these systems are a one-stop shop system, which makes it easy for hospital labs to use them.
Yeah.
The problem is cost, of course, because the more closed systems you have, the more automated these tend to be expensive and not always applicable to areas where you actually have very high prevalences of antibiotic resistance, like the low and middle income countries.
Yeah.
So these are, of course, broader issues, which we also talked about yesterday in the Global Leaders Group, in the think tank session, of how to bring together policymakers, stakeholders, microbiologists, clinicians, to not only talk about the scientific development of diagnostics, but also to leverage these diagnostics to hospitals where they're actually needed.
Yeah. Yeah, because you just mentioned you were part of the Global Leaders Group event on AMR, also the think tank. What would you care to share with us your most important take-home message or thing you got out of that think tank?
So there were three of us talking on different aspects. I covered the microbiological aspects, of course, talking more about development, but also uptake and the problem, or I should say the fact that we will have new IVD regulations, in vitro device or diagnostic regulations coming up in place also in the EU. And we were discussing what the impact would be, both for manufacturers but also for hospital labs, who will find it even more difficult to have tests that they've developed themselves, which means that they will be forced to take commercial tests. And there are a lot of repercussions of these, which are becoming evident and will become more evident because the rules come into practice from 2028. And then there were other colleagues from India and from the UK who talked about the importance of surveillance and the importance of education and actually having a very simple point of care test for very high prevalence settings. So I think the general message that at least I could take from the think tank was we need to bring people together, and this has to be a completely joint effort. It cannot be simply development, it cannot be diagnostics, it should also be antimicrobial drugs plus diagnostic pathways, plus regulatory constraints to be taken into consideration along with stakeholders on the table and really brainstorm about how to take this forward.
Yeah, well, thank you. Yeah, it's a huge, AMR is such a huge problem and such a multifaceted problem. There are so many issues to be identified or that are identified that it's wonderful that the ESCMID Global offers a platform in which we can bring people together, and the Global Leaders Group also bringing it together with the policymakers.
I'm really happy this year, ESCMID, and I'm really pleased with the program because there's a huge focus on AMR diagnostics, but also on antimicrobial stewardship, diagnostic stewardship, IPC, so many different angles of AMR. So that's really great that it's being put up so high on the agenda.
So Jaroslav, you'll be speaking right after Surbhi tomorrow at the educational session. What will you be focusing on during your talk?
So I have almost nothing to add, but of course in the case of cultivation-based techniques, we have some novel possibilities how to determine antibiotic resistance very quickly. We are not so rapid because, of course, still we need to have a culture, and comparing with genetic techniques, we are still not able to detect microbes and their antibiotic resistance directly from clinical specimen, despite we have some techniques under evaluation, but those that are used in clinical practice still requires the culture on the plate, like classical microbiology, or to have a positive blood culture. But we can somehow shorten the time to have efficient results for our clinicians. Still, they need the answer almost immediately when they have critically ill patient, for example, a patient with sepsis in ICU. They need to know information about the proper antibiotic therapy very quickly. So in the last 15 years, I would say, we can see emerging of new techniques, especially of Malditiv mass spectrometry. I remember when we received Malditiv mass spectrometry in my laboratory in 2010, that it completely changed the diagnostics, that we could shorten the time for identification for 24 hours. It was something amazing. But not only cultivation, not only identification of the cultures can be done by such a technique, but we can also detect resistance mechanisms like carbapenemases, and also we can detect colistin resistance very efficiently. But still we have some cultivation techniques that can very rapidly answer the proper antibiotic therapy. Like the basic one, rapid susceptibility testing from blood cultures, that is evaluated method provided by UCAST. But we also have some techniques that we can detect the growth of the bacteria in presence of the antibiotics, and we can have results again very quickly within 2-3 hours after we have a culture of the microbe. And of course, big group of our tests are immunological based tests that we detect specific markers of antibiotic resistance, like carbapenemases, colistin resistance, proteins responsible for colistin resistance. So those techniques are also very important in clinical diagnostics, and we can see nice novel techniques that are under evaluation.
Yeah, so you're really nicely describing how in just a relative short period of time, in like 14, 15 years, that the diagnostic side for antimicrobial resistance has taken a huge flight or a huge leap ahead. So what's in the pipeline still, research-wise, for you? Is that something you can share here?
Yeah, so for example, for me, the amazing medical microbiology is to see the interaction between the living organisms, the pathogen, and the host. And I think that the research will go to understand this interaction and to propose the methods that are not only limited to detect specific pathogen, but also to detect a specific response of the organism connected with specific pathogen. And as you correctly mentioned, it's very relative to say that something is rapid. And as I know from my colleagues, clinicians, they would like to have results like from biochemistry immediately after the admission of the patient, and still it's very difficult despite we have some possibilities to identify causative agent of the infection very rapidly.
Yeah. And how is it for you, Surbhi? What is your research focusing on in the near future?
Well, yes, I'll be presenting a part of it as well. What we are trying to do, so we utilize metagenomics. We have our own platforms in the lab, but we are using it now to develop predictive markers. We are mining the microbiome, primarily the gut, but also the respiratory microbiome. And I have some results on the gut microbiome where we are looking at the possibility of being able to predict at baseline when a patient comes to a general practitioner as to what kind of antibiotics are likely to cause the worst kind of dysbiosis in their gut microbiome, and therefore the possibility for the clinician to give alternative antibiotics. And this is based simply on the kind of microbes that are present in the gut microbiome of that patient. So I think in the next, and I'm probably looking far into the future, in the next decade or so, I think the field will move. We will have, I hope we will have very rapid diagnostics for infections. And then microbiologists would probably attempt to go for predictive diagnostics to actually prevent the patients from...
And that's very individualized, right?
It's very
a really
individualized,
personalized or
absolutely. That is
precision
personalized medicine,
Yeah.
absolutely. So
Yeah.
I think that's where the field will move into, in the
Okay.
very far future, maybe.
Yeah, well, super interesting. So, but tomorrow you'll be focusing on the educational side of it and bringing the message across because, as I understood, there's a lot of work to be done there also.
Yes, I mean, we've
Yeah.
had, as you very correctly mentioned, the last 10, 15 years have been, I mean, microbiology has really taken off, as you put it, and now is the time to sit back and see what are the outcomes. Has it
Yeah.
really impacted? Have these tests, both phenotypic and molecular, have they really impacted in any way the time to result, the patient outcomes, and very importantly, stewardship programs in hospitals?
Yeah. Well, thank you both for taking the time and effort to come here and give us a little bit more insight and background information on what people can expect at the educational session tomorrow. For our viewers, tomorrow, the educational session that we have been talking about will take place at 8:30, from 8:30 to 10:30 in Hall F, so don't miss out if this is your topic and field of interest. Thank you for watching and joining us again here at ESCMID Global TV. We will be back tomorrow. We're wrapping it up for today. We will be back tomorrow at the clock of 10 when we will be starting with our first new live interview. We will be talking at 10 o'clock with the president-elect for the TAE, the Trainee Association for ESCMID, and a TAE awardee who will also be joining us to share some experiences with the TAE. So don't miss out on that, and I hope to see you then at 10 o'clock.